Good day, everyone. My name is Esther Seow. I'm a Year 1 medic student. Today, I'm going to talk about the urinary system, which is in the nephrology specialist, and the main organ is kidney. And I'm going to talk about the anatomy of kidney first. So, for the characteristics of kidney, it is reddish brown in color, and it exists in pairs, which is at the left and right side of your lower abdomen, and it is located at the posterior and lower abdomen, and it is approximately 3 vertebrae in length. And the components of kidney involve renal capsule, which is the outermost layer of the kidney, and the renal cortex, which is the second layer from the outer layer of kidney, and the renal medulla, which is the pyramid shape in the kidney, and the renal pelvis, which connects the kidney to the bladder. And next, I'm going to talk about physiology of kidneys. The function of kidneys include blood filtration, reabsorption of nutrients, secretion of waste, and excretion of urine. And it also regulate blood pH, and regulate also electrolyte level balance, and eliminate substance that was not filtered in the first step, which is the blood filtration. Now I'm going to briefly explain about the process, which the each kidney contains like over a million nephrons, and each one plays a crucial role in filtering blood and forming urine. And blood enters the nephron through the afferent arteriole and flows into the glomerular capsule, where filtration begins. Here, water and small solutes pass into the capsular space, while larger molecules like blood cells remain in the bloodstream. The filtered fluid then travels through the proximal convoluted tubule, where the essential nutrients like glucose, amino acids, and ions are reabsorbed back into the blood. Next, then the fluid moves to the loop of nephron, which concentrates the urine by reabsorbing the water and salts, and then it continues into the distal convoluted tubule, where further adjustments are made to the electrolyte balance and pH. Finally, the collecting duct gathers the processed fluid and channels it toward the renal pelvis, eventually forming urine. And surrounding this entire system is a network of peritubular capillaries and venules that help reclaim the valuable substance and carry away the waste. And the kidney performs several vital functions, which I have mentioned before, which the blood filtration and all, to balance the homeostasis in our body. Now, I'm going to talk about the biochemistry of urinary system, and I'm going to begin with the filtration, which occurs in glomerulus. It is a specialized capillary network housed within the glomerular capsule. Filtration is driven by hydrostatic pressure, allowing the small molecules like water, glucose, urea, sodium, potassium, and bicarbonate to pass through into the capsular space. Larger molecules like proteins and blood cells are retained. This selectivity is based on both size and charge, which negatively charged proteins are repelled by the negatively charged filtration barrier, which help to prevent the loss of essential proteins. The structure of glomerular capsule itself supports this process, with its visceral and parietal layer creating a space for ultrafiltrate to collect before moving through the nephron. Now, like how the kidney regulate blood pH is by playing a vital role in maintaining acid-base balance by secreting hydrogen ion into the tubule and reabsorbing the bicarbonate. This process relies on the enzyme carbonic anhydrase, which catalyze the reaction between carbon dioxide and water to form carbonic acid, which is the intermediate that helps buffer blood pH. Through these mechanisms, the kidney keep our blood pH within a narrow, stable range, which is very important for the enzyme function and overall cellular health. Beyond filtration and pH regulation, kidney also contribute to broader physiological balance. They release renin, which initiates a hormonal cascade to raise blood pressure and retain sodium. They produce calcitriol, the active form of vitamin D, which enhance the calcium and phosphate absorption in the intestine, and they secrete erythropoietin, a hormone that stimulates red blood cell production in the bone marrow. Altogether, this biochemical function highlight the kidneys not just as filters, but as dynamic regulators of homeostasis. Now I'm going to continue with disease related to nephrology, which is one of the common one, kidney stones. The symptoms involved is sharp pain in the side lower abdomen or groin and presence of blood in the urine and even abnormal color of urine which is pink, brown and red, and experiencing pain during urination is also one of the symptoms. For the treatment, medical procedure like removing the stone or break it into smaller fragments to allow the stone to pass through in urine is also one of the treatment. And to remove the stone, it can be done by surgery. And for advanced technology related to nephrology, it is wearable artificial kidneys, which is WAC. And how do the patient use it? It is usually worn on the body, like around the waist. It is more convenient because the patient doesn't need to go to the hospital often, and they can move more freely because it is not like a big machine in the hospital, and it is a continuous filtration similar to dialysis, and it can also improve the quality of the patient's lifestyle because they don't have to use a lot of time to go to hospital and so on. Finally, I'm going to talk about specialist in nephrology, which is Richard Bright. He is the father of nephrology, and he is also the first to describe the link between kidney disease and clinical symptoms like edema and proteinuria. He was the first to link patient symptom with the autopsy findings and creating the scientific basis of nephrology and internal medicine. And he has contributed a lot in nephrology and carried down to the modern medication now. And that's all from me. Thank you.